Welcome everybody to this live stream, whether you're watching on Facebook or LinkedIn or in the Facebook group for Functional Medicine Pharmacists Alliance. My name is Dr. Lauren Castle, and with me today I have Melody Hartzler from the pharmaceutical team and FxMedCE.com. So I wanted to bring Melody on to the live stream today to talk about the upcoming symposium that's this Saturday. It's going to be all day. We're covering 7.5 hours of CE.
Lots of things, yes.
So tell us a little bit about the topic on Saturday and why this particular topic is so important for pharmacists to learn about.
Yeah, so we are so excited. Like Lauren said, our program is coming up on Saturday, and this event is basically all the practical approaches to detox and biotransformation through that functional lens. And I think it's so important because we know, and we always get this like sort of pushback from providers in the community when we start talking about detox as like a buzzword. And Larry and I had done like a live on LinkedIn not too long ago and just talking through that and how providers are like, well, you have kidneys and you have a liver. And yes, that's true. But in our world now, we are bombarded with so many chemicals, so many things, whether it's from plastics and foods that we're eating or in the soil or in the water. I mean, we've had all kinds of crazy things, these train wrecks that are causing, Ohio River to be covered in, some of these chemicals. So there's just so many things that we're exposed to now. And while our body was designed to get rid of those things, then, it really can't keep up with what it's being exposed to. So we want to help our patients who are experiencing some of these toxicities from different things, whether they're experiencing insulin resistance or they're just, having more allergy symptoms or just sort of overloaded as far as their liver congestion, like, and some symptoms related to that. We just really want to make sure that we have the understanding of the process that's going on, and that when we're asking people to detox, that we're doing it in a scientific manner and not just like, hey, there's this juice cleanse, or, some of these things that are out there that maybe don't have that science behind them and supporting the phase 1 and phase 2 reactions. So one of the other important things I think that a lot of like detoxification conversations don't have is this like mental detox component, and that our stress levels like impact our detoxification and our body's ability to get rid of some of these things. And so definitely, started, and Nicole Grams, who's fabulous as a health coach and a pharmacist, but she really talks about a lot of that. And so she's going to hit on at the beginning some of, the defining toxins, reviewing the phase 1, phase 2, phase 3. Everyone that signs up on Saturday will also get access to a program we already put together this year that's on demand that you can do as like a review this week. So we're going to be sending out an email tonight, just reminding people that's available if they have time to go through that before Saturday, because I think it's a really good foundation. But Nicole's going to be reviewing a little bit of that, and then also, really talking about how stress and the mental component, because when you're asking people to do, whether it's a 14-day, a 28-day, maybe a 6-month program, some of us are using some companies now that like get down to the cellular detoxification level for 6 months. And that's a lot of ask for a patient. And so how do we actually help them, with that mindset work, or even us as patients of our own selves? How do we get ourselves to the point where we know we need to do that? And so the other thing I think that's important that doesn't get talked about a lot in the pharmacy space is like that workup, and like what do we do? Because pharmacists, we're not the diagnostic people, but we are the people that can help still uncover the root cause. So we can't diagnose you something, but we can say, well, this might be contributing. And so Dr. Kate Henry, who's a naturopath, is going to be talking about all the testing. So what tests, how to use them, when to use them, and also talking about some of the assessment, the physical assessment things. A lot of us learned physical assessment in school, but it was very much focused on, your typical exam room as I'm sitting here in the physician's office, like the exam room things that you might do, and not as much about some of these really specific things related to toxins. So she's going to be going through that, and then we will take a lunch break. And we are not doing any sponsored presentations during this day, which is new this year, but we really pulled that out and are doing those as free webinars. And that way people can actually take a break, take a walk, go eat lunch, and really, have some breaks during the CE day, because we know it's a long day, especially this time of year if you are, joining us in the busy season, as some people have coined the Maycember term. And then Lara, our fabulous pharmacist, nutritionist, is going to be talking about the nutrition approaches, of course, and talking about the gut interplay, the immune system interplay with the detoxification pathways, and then looking at strategies of upregulation to the detoxification capacity. So specifically with dietary patterns, but also therapeutic foods. And then we're super excited because we have two clinicians that are bringing cases and protocols at the end. And I know that's always something people are looking for, but Dr. Lynn Patrick has like literally devoted like her whole career. She's a naturopath as well to toxins, environmental toxins specifically. She does a lot of work on heavy metals. And so I think that's something that's like been, at least in my career, like unclear for me, like who I should be. Like I know heavy metals cause something. And so I'm really excited to learn from her, because I know like it's like, okay, if I do this LabCorp blood work on heavy metals versus urinary, which one should I do in the urine? Which one should I do in the blood? Do we have to provoke them? Do we not? And I don't necessarily think that our average pharmacist is going to be out there provoking heavy metals, and we probably shouldn't be. But I think it's important for us to be able to at least identify, like, is this a problem for someone, and find the specialist in the community that, that's within their scope, or they might be doing that. So I'm excited to hear from her and just all the data that she has surrounding that, because I mean, she could probably talk to us for like days and days about all the data that she's gone through. And then we'll finish off the day with Dr. Philomena Trindade, who is an MD that is both IFM certified and A4M certified. And her focus of detox really focus on estrogen detoxification. So that's going to be a good one as well that you don't want to miss. And if you are busy on Saturday, again, because I know it is that time of year where at the end of the school year, sporting events and plays and recitals, and my daughter has dance picture day, like all of those things are, happening. You can still get this information on demand. So you can purchase now. And then as soon as the video content is rendered and we break it up and edit it takes us a little while to do that. So probably about a week after the conference, those on demand program will be available.
Yeah, I'm super excited. Likewise,
Yeah.
I will be at a graduation this weekend, so I will be catching the replay, but this is something that I am also super passionate about. For me, heavy metal detoxification was one of the first functional medicine topics that I kind of just jumped into whenever I was working back in Flint, Michigan during the water crisis. And I had patients that were coming in. We actually partnered with a nurse company that would do like finger stick lead tests and some different things. And it was just so overwhelming, because I'm like, I have no idea like what I should be telling these patients. So I was really trying to just like look for any resources I could and kind of talk to them about like vitamins and nutrients and things to like keep the lead suppressed in the bone instead of having it circulate. And like, it was just so terrifying for these poor kids.
It's
right?
hard. Yeah, and it's hard because a lot of the stuff we know, I think we know a lot about what the toxin does and what, happens. But as far as like how to like get rid of it, and like what the appropriate protocol is for a pediatric kid versus an adult, and, all of those things, I think it really does take a specialist. So I'm glad we do have some of those specialists that are joining us. And, hopefully, if anything, it allows us as pharmacists to really help identify those people and help find them, the care, whether it's with us or someone else, that can really, really make an impact on their health.
Yeah. I think it's really important to, like you said, to kind of be able to differentiate between different types of detoxification processes, because it's not, sometimes it can be really dramatic if like someone's got really crazy high levels and things, right? But then there's also a lot of just like the everyday things that we can do to support our body's natural abilities to process these different toxins, heavy metals, xenobiotics, whatever you are potentially being exposed to. And I think that's something that kind of gets missed a lot, is that it's easy to just think like, oh, I have to go all in. And it's like, how can it be gentle and not cause a bunch of symptoms, right? Because that's kind of the other side of it. When it's done wrong, it can really potentially be quite dangerous in some cases. So I think that's kind of, again, like the
we don't want to push them in the wrong, over, if we're not addressing phase 2 and, even like pooping and things like that, and then we're driving phase one, like we might be creating a worse picture for a person if we don't do it sort of in that backwards approach too. So
yep, absolutely. So
yeah.
for those who are new to the Functional Medicine Pharmacists Alliance pages, or maybe you're seeing this for the first time, we do have a discount code for FxMedCE. So if you're a member, you can get 20% off. That code is in your members benefits page. If you're not a member and you're just one of our general community pharmacists or pharmacists out there that are watching and you haven't joined, you can actually use the code FMPhA for 10% off. And you can go on to FxMedCE again to redeem that. So we look forward to seeing everybody on Saturday. Again, sign up, even if you're just going to be able to watch the replay.
Yes.
This will be a really awesome CE session. And of course, everybody can always use more CE.
Yeah. And I think too, like, you know, when you're thinking about developing programs surrounding your, you know, at your pharmacy, or whether they're online programs that you're going to offer to patients, like detoxification is definitely an area that people are interested in, like patients are interested in, they want to hear more about. So like the better educated you can be in those conversations, I think this could lead to, you know, profitable programs in your pharmacy too. But I think, you know, making sure you understand the ins and the outs and who's a good fit, like Lauren said, like, and who, you know, maybe needs some more work before they should go through a detoxification protocol. You know, just signing everybody up for a protocol sometimes isn't the best. And so when we do like our 14-day reset or things, we are, you know, from Farm to Table's perspective, we're always like, okay, if you have this, this, and this going on, or you're not pooping and you're not doing this, like you need to wait on this. And so I think that no more, the more you know, right? Like I think about like the MVC, like the more you know, like it comes up on the screen, but the more you know, I think the better off your patients are going to be. And, you know, when you're implementing those programs versus just taking things out of the box and saying, here I should do this, you're going to know more of those like nuances to when to use this diet protocol, when to say, okay, maybe they can actually have caffeine during this because, you know, that's not really affecting their detoxification. Like maybe this, you know, individualizing, I guess, some of those protocols that are out there too is really important. So I think this will sort of bring all that together.
Yeah, absolutely.
Yeah.
I was just posting the link and the discount codes for everybody that is looking for those in the comments.
Sure.
But other than that, I am super excited. Any other things that you think people should know about in terms of joining this weekend?
No, I don't think so. I mean, that's what we have up for this weekend. And then if you are interested, the annual pass has also on-demand CE throughout the year. So we've got 2 programs up already this year, the foundations, and then also the intro to pharmacogenomics. And then we're going to have nutrigenomics in the summer. And some other programs throughout the fall, which are all listed on the website. But then we're also going to be touching on men's health with that annual pass. The annual pass covers all like our virtual programming and on demand. And then if you do want to hang out with us, because Lauren is super cool and you definitely want to come visit with her, but we are going to be in Nashville at our annual FxPS or Functional Medicine Symposium. That is not included in the annual pass because there's some more fixed cost and food and venue space and things. But that is going to be in September 23rd in Nashville. So we loved it so much last year. We're going back to Nashville. So if you're interested in that topic's gonna be more cardiometabolic. So you can check out the webpage. It's basically functionalmedicinece.com/FxPS 2023. But Lauren can put the link with her discount code as well under this.
Yeah, we are super excited for the in-person symposium. So definitely mark your calendars now. We'll send out some more information to get everybody registered.
Yeah, we have a Friday night event.
Yes, definitely plan to come in on Friday, getting there early. That way you can kind of get the networking going. It was always super fun just to get everyone there and get the energy in the room excited.
Sure. Yeah.
So,
well, thanks for having me on today. I know you've got a busy schedule of more pharmacists to chat with in person today, but
yes. So thanks so much.
I'm jealous. You'll have to tell Blair I said hi.
Yeah, I am headed to Columbus after this. So stay tuned for more updates with all of that as well. But thank you so much, Melody, for coming on, and we'll see you all on Saturday.
Bye.